Okay, so you've just had a tooth taken out. And if you're anything like most people, you're probably feeling a little bit anxious, maybe peering into the bathroom mirror every 5 minutes, wondering, is that normal? Well, don't worry. I've got you. This is your clear visual roadmap to what's going on in there and how to have a perfect week of healing.
Here's what we're going to cover. First, we'll walk through the day-by-day healing timeline so you know exactly what to expect. Then, we're going to tackle the big one, the fear of a dry socket, and I'll show you exactly how to tell the difference between that and normal healing. After that, I'll give you a super effective pain relief plan, and finally, we'll talk about how to protect your smile for good.
But first, let's just get right to the number one question that sends everyone to Google. What is that weird white stuff that's starting to form in the socket? I promise you, we're going to get a crystal clear answer on that, and it's probably not what you think.
All right, let's kick things off with section 1. We're going to look at what a healthy, totally normal recovery actually looks like. Your body is an amazing healing machine, and it follows a really predictable pattern. Let's break it down. So here's the whole week at a glance. It all kicks off with a super important blood clot. Then that mysterious white stuff makes its appearance. And finally, the socket really starts the process of closing up for good. Each of these stages is absolutely crucial for the next one to happen correctly. For the first day or two, your body has one main mission: to form a dark jelly-like blood clot. Now, think of this clot as your body's own perfect little bandage. It's a natural shield that protects the bone and the nerves underneath from air, food, and germs. Honestly, protecting this clot is your number one job right now. And here we go, the answer to our big question. Around day 3, you're going to look in there and see some whitish, maybe yellowish tissue forming. I know it can look alarming, but this is not pus or an infection. This is called granulation tissue, and it is a fantastic sign. It's brand new tissue, packed with new blood vessels, and it's the scaffolding your body is building to create new gums. Seeing this means you are healing perfectly. Okay, let's talk about the thing that causes the most stress: dry socket. So much of the fear just comes from not knowing what it is or what to look for. So right now, we're going to kill that anxiety with some clear, simple facts. So what is a dry socket really? It's actually very simple. A dry socket is just what happens when that protective blood clot we just talked about goes missing. Either it gets knocked out or dissolves before that new granulation tissue has had a chance to cover everything up. It's that exposed bone and nerve endings that cause all the trouble. This chart right here, this is going to be your best friend. With normal healing, your pain might peak on day 2, but after that, it should get noticeably better every single day. With a dry socket, the pain suddenly gets way worse a few days in. And it's not a dull ache, it's a sharp, radiating pain, maybe shooting up towards your ear. And when you look, you'll see an empty-looking hole, maybe even a bit of bone, instead of that healthy healing tissue. And let's put this into perspective. A dry socket only happens in about 2 to 5% of simple extractions. I know it feels like everyone talks about it, but the truth is, it's pretty rare. If you follow your dentist's instructions, your odds are even better. But what if you do think there's a problem? Okay, the plan is simple. First, do not panic. This is a very treatable issue. Just gently rinse your mouth with some warm salt water to clean the area a bit, and then call your dentist's office right away. They'll know exactly what to do to get you out of pain fast. All right, so now you know how to spot a real problem. But what about just managing the normal soreness you're definitely feeling? Well, instead of just winging it, there's a really effective schedule you can follow to stay ahead of the pain. This is the gold standard for controlling post-op pain without narcotics. You start with an anti-inflammatory like ibuprofen. Then, 3 hours later, you take a different kind of painkiller, acetaminophen. By alternating them every 3 hours, you create this consistent level of pain relief so the pain never gets a chance to break through. It works so well. Now, of course, and this is really important, you've got to check with your doctor before you start any new medication plan. Make sure it's safe for you, and please, never, ever go over the maximum daily dose that's listed on the bottle. Okay, we've got you through this first week, but the real goal here isn't just to heal from this one extraction. It's to make sure you don't have to go through this again, right? The secret to that is supporting your health from the inside out. Think about it. An extraction doesn't just happen out of the blue. It's usually the final step of a longer problem, like weakened gums or an imbalance in your oral microbiome. That's the collection of bacteria in your mouth. And while brushing is super important, it's only really cleaning the surface.
So, one way to tackle this is through nutritional support. There are formulas out there, like one called Dentalin, for example, that are designed to hit those root causes. They give your body the building blocks it needs for strong gums and a healthy, balanced environment in your mouth. So, you might be wondering, how does that help me right now? Well, giving your body the nutrients to build stronger gum tissue can help promote a more solid recovery. And creating a balanced environment with fewer bad bacteria is exactly what you want when you have an open wound that's trying to heal. Plus, as a nice little bonus, it targets bad breath at its source. And this isn't just guesswork. This approach is backed by real science. We know for a fact that vitamin C is absolutely essential for making collagen, which is literally the protein that builds your gums. And other things, like xylitol, have been studied and shown to help reduce the harmful bacteria that cause problems. It's all about giving your body the right tools for the job. And you can see how this plays out for real people. For example, a user named John tried a formula like this and said that after just a couple of months, he could literally feel that his gums were healthier and his breath was fresher. That's a real, tangible difference. And look, if you're a little skeptical, I get it. That's why the company that makes Dentalin is so confident that they offer a full 365-day money-back guarantee. That means you can literally try it for a whole year. And if you don't feel the difference, you get your money back. It's totally risk-free. So here's the takeaway. Healing from this extraction isn't just about getting through the next 7 days. It's about setting yourself up for a future where you hopefully don't have to get any more teeth pulled. If you're ready to tackle the root cause and support your body's health from the inside out, go ahead and click the link to learn more.